Today is Friday, June 19th, and we continue to provide you with a few updates. We have been monitoring the COVID-19 pandemic for over 111 days from the Emergency Operations Center, or the EOC, since the county declared an emergency on February 27th. We're continuing to provide resources to cities, fire districts, and our local partners, and providing accurate and helpful information to the public, and sharing details on how we can all do our part to keep each other safe. Many are wondering when we will enter phase 2. It's important to remember that this disease is prevalent and we need to approach the reopening with caution. Clackamas County entered phase 1 on Saturday, May 23rd. Today, we are entering our 28th day in phase 1 and continue working towards phase 2. Even though the governor has decided that Clackamas, Multnomah, and Washington counties will enter phase 2 together, Clackamas County has submitted our request to enter phase 2 so the governor can consider our application when she's ready. But I'd like to take the opportunity to share what that means for Clackamas County and our community. Phase 2 requires 6 very clear metrics that the county has to meet or must be trending in the right direction. And a quick note, when I say the county must meet these metrics, I mean that our community must meet these metrics. This is not work that the county as an agency can do on its own. The governor shared that her reason for delaying phase 2 is because of those 6 metrics were trending in the wrong direction across the state, and we do not want to overwhelm the healthcare system. Here in the county's EOC, we are busy working to meet the metrics by increasing our contact tracing capacity, investigating outbreaks as they occur, and supporting recovery from those outbreaks, and collecting necessary PPE and delivering them to emergency and essential service providers. We must do this work together. It's not only the county's work, and it's not solely relying on the public. We are in this together. Please wear face coverings when you're out in public, visiting stores, or in a populated space. If you have to meet with people, please prioritize outdoor locations if possible. Wash your hands as often as possible when returning to your house after contact with the people and materials outside your home. And most important, if you're feeling sick or are experiencing symptoms, stay home and call your medical provider to confirm if your symptoms are contagious. I can promise you that everyone here in the EOC is ready for this pandemic to end. Reopening the county, moving through the phases, is not the end of the pandemic. These are measured steps that we can do together to continue meeting our essential needs and also begin economic recovery. But the health crisis is real, it remains, and we need your help to stay vigilant. Thanks for listening, and thanks for joining us here in the EOC today.